My name is Mike Westerhouse. I am a primary care physician at a clinic called the Center for International Health, which is located in St. Paul. The clinic has been around for about 30 years with a primary mission to serve refugee and immigrant patients from all around the world, which includes a large population from Southeast Asia, from Cambodia, Vietnam, Myanmar, Burma, the Karen, from a Bhutanese Nepali population, and also a large East African population, primarily from Ethiopia and Somalia. I've been practicing here for about 8 years in my role as a primary care physician, and then I'm also very involved in educational efforts outside of clinic to teach health professionals how to understand the social and structural determinants of health. In my time here at the Center for International Health, there have been numerous lessons that I've learned. There are a couple I think that really stand out for me. One of those is that health happens outside of clinics and hospitals. Health happens for people out in their lives in the community. And that actually has been a big learning for me, because in our training as health professionals, we're taught to think that health happens really because of what we do in clinics and hospitals, and I think we have a role to play. But the vast majority of where health and well-being happens is out in life, where people are exposed to much larger social forces that have an impact on their lives. And so an example of a patient who I saw not that long ago, but who I've known for about 7 years, is a younger man in his lower 30s, who first came to Minnesota, I think in 2013, seeking asylum. He was from Ethiopia and had some very adverse experiences with the government there that's had him seeking political asylum here in the US. And he came in, he got connected with a legal team. We took care of his sort of basic healthcare needs here, and he was doing fairly well over the last 4 or 5 years. He was working on a degree at the University of Minnesota. He had a job working at a travel agency. Life was fairly stable, and I actually lost track of him until about 2 months ago, because things have been going so well for him. He came in and he said, I'm having an awful lot of abdominal discomfort. I'm like having constipation some days, I'm having diarrhea other days, I don't know what's going on. And he looked worn down and tired to me. As we started talking, I kind of went through my standard things of like, well, what could be going on in it? Does he have a bacterial infection? Or he thought it felt like a parasitic infection he may have had previously when he was back home, and talked about like what he's eating, and is he eating enough fiber, and like things that would sort of help regulate his intestinal tract. And we also talked about exercise for him. He previously had been like someone who jogged every day, and he wasn't like doing much exercise. So I'm kind of running down like my standard checklist of like what could be going on inside the body, or is it have to do with some behavior, like he changed what he's eating, or he's not exercising as much as he should. And I was close to finishing my visit with him when I happened to ask him, like, is there anything else, like how are things going in life for you? And he shared with me that last year, at the end of the year, actually he had to withdraw from his program that he was involved in at the U, because his finances were running out. He had stopped exercising, he had stopped like eating much, he was feeling pretty low about life, and he said, I'm really actually worried about what's going to happen with my asylum case. I haven't heard anything from the lawyers recently, and I'm really worried that things aren't going to work out. Then it turned out that his asylum case actually had been denied like a couple of weeks before that. And so that opened a whole new door to trying to like understand what was going on inside of him. And I said, well, we can still look at whether it might be parasites, or whether it might be what you're eating, or whether you're exercising, but it may also be connected to the deep connection sort of between feeling stress in our lives and sort of how that gets transmitted in our bodies. And like that made an awful lot of sense to him. And so the reason I bring that up as an example is I think it would be very easy for a health professional who's busy in a primary care clinic, and I'm guilty of this often, to just think like there's something in the body or there's something going on with what he's doing or not doing in terms of following my recommendations, when clearly I think sort of the etiology of his discomfort and what was going on had to do with these much larger things going on in his life. Things which I think he didn't feel like he had control over, but were very disruptive to sort of what his vision of how he was going to be able to move forward in life was. So I'm constantly reminded that the social, the structural context within which people live is profoundly impactful on their health. And as health professionals, we need to understand that much, much better to recognize both the negative and the positive ways that things that are the social context can influence patients' health. We have a particular culture ourselves, which is often we're trained in a way to think about, like we have an agenda in some ways. And when I'm thinking about it with like a preventative care. So when we're thinking about like doing colon cancer screening and we're thinking about doing breast cancer screening, cervical cancer screening, like when people come in for those things, we feel like we want to make sure those things get done, that we get to like check the boxes off. And we often want to have that happen as soon as possible, sort of according to the timelines within which we get guidelines for those things being done. And it reminded me, as I was thinking about this, I thought back to about 7 years ago when I had just started my practice here, and there was a guy that I met, also an Ethiopian guy. This guy was in his mid-50s, was doing work as a plumber in the community, and he had come in. It was one of the first times I had met him, and he was due for having colon cancer screening. And so diligently, as I'm trained to do, I said, hey, have you ever thought about like doing colon cancer screening? Like, you're over the age of 50, it's something we recommend for everyone. And I remember him turning to me and saying, you Western doctors, like you're always just trying to find problems. You're always seeking to find problems in people's bodies. And he's like, I don't have any interest in doing that because I don't feel like I have a problem right now. I more trust that my health is going to tell me when I feel bad, and I'd rather not like go seeking problems all the time. And some of it, so right there at that moment in time when I left that, I felt fairly comfortable with him saying that, but it was clearly a response, and I think a challenge to like my authority or power as like a Western health provider who's like got my agenda of things to do. And so I left that visit thinking, well, I guess he's not going to do colon cancer screening, but like, in what way can I like figure out how to convince him to do it? You know, and so there was in some ways not a total like respect of like where he was coming from. So I've continued to work with him, and like for 4 or 5 years, we built trust, got to know each other much better. And I would always ask him every year, like, have you thought about doing colon cancer screening? And he still was like, nope, I have no interest in doing that. Until about a year ago, he said, you know what, I've been thinking about this. I've known a couple of people who have like struggled with and been diagnosed with colon cancer, so I'm interested more in like what this is about. Tell me a little bit more. And so we talked more about it, and he decided to go ahead and have some form of colon cancer screening. Voluntarily, he was like, I want to do this now for my health. And everything was fine, like when he did the screening. But we were talking about it just a couple weeks ago, and we were talking about what the lesson for me is just how important like a longer term relational commitment is with patients. Part of probably why he was skeptical originally was like, who is this guy? I don't know this guy who's telling me to do this, and I've never been told to do it before. Why am I being told to do this now? And it took numerous years of kind of like building trust and like getting to know each other to sort of get to the point where it felt acceptable and appropriate for him to do colon cancer screening. So for me, it's been a big lesson for me that we can't think about like just checkboxing something like colon cancer screening. We need to, because I think we see that then as more like a singular event that we need to take care of, but we need to understand it more as a process that builds on longer term relationships with patients. One of the things that I think as I reflect back on it is it also demonstrates sort of a cross-cultural moment that unfolded over time. And I think I could go back to that very first visit, and I could interpret that as, oh, he just doesn't understand the value of colon cancer screening. My job is to fill in his understanding of it, and then everything will be fine. But I think another way you could interpret it is actually there's some cross-cultural maybe conflict or tension there between my belief that if we do screening ahead of time, then we can find things before they turn into a problem. Whereas he may be coming from a belief system that may say, let's let life unfold the way it will, and things will happen. And when they come to the surface, then I will take action on them. So I think there's many reasons we may have, it may have been trust as well, but I think also there is maybe a different belief system about like, why are we doing screening and why are we not? That I think over our relationship over time, we were able to like discuss and then find a meeting ground. Two other lessons that I found are that have been like humbling for me to learn in my time here is one, the importance of recognizing how I walk around with assumptions about patients all the time. And those assumptions are built upon years and years of medical training and also years of like what I've been told to think about other cultures. And so for me, one practice that has been very useful is to, and often assumptions kind of play out at the level of our subconsciousness unless we intentionally take the time to bring them into our consciousness, is to, before I walk into any exam room with a patient here, because most of the time I'm involved in cross-cultural care here, is to just pause for a moment, maybe take a deep breath and just say, what assumptions am I walking into the room with? Just taking a moment to do that can help me be a little bit more cognizant of the ways in which assumptions I have are affecting the way I'm interacting with the patient, even maybe the treatments that I'm offering or not offering because of a set of assumptions I have. So that's something small that I've tried to integrate into my daily practice as a way to just say, I know I have assumptions. I'm probably never gonna completely get rid of assumptions because that's how we operate as humans, but there are things I can do to make sure that I'm aware of what those assumptions might be. And then the other thing is, I think in our training as clinicians, we are often taught to see culture as a barrier or an obstacle to actually achieving what we want to achieve through sort of a Western biomedical lens. And unfortunately, what that does is it prevents us from seeing the tremendous assets that people have to draw on from their own cultures. And things that when I'm talking about assets, things that I think fall into that realm are the real importance of like story and storytelling for particular cultures, oral traditions, the importance of like family and like tight relationships, and people seeing themselves not as individuals, but as part of a community is a cultural asset that some cultures hold. So I think it's really important to see culture and to draw on what those assets are as we like think about what our treatment plans are gonna be. Because if we don't, we're missing like a major opportunity for like collaboratively working together with patients. So.